We're going.
Okay. Well, we have a small turnout today, so we'll try and keep this quick. I know Bill has a meeting he needs to go to. So as soon as Bill appears, we'll go with him. First treasurer's report. Spent a little money on Kathy's expenses for these certificates. Item 2, recruitment and retention of MHB members. 3 vacancies are shown, there's no change. There's Bill. Bill, I know you have to go. You want to present a little update on the division?
Sure. We have interviews scheduled for the end of the month for our SUD section manager. So that'll be an important position for us. After that, we have a lot of general recruiting going on. I think we're experiencing what is happening nationwide, which is recruiting right now, just not as easy as it normally is. I think people are still locked down and dealing with children and family and such. So we've had, for example, we're gonna have to do another round of behavioral health clinician recruiting because we didn't get enough applicants in the last round. The Board of Supervisors is going to have on its July 27th meeting, review the county's American Recovery Act funding status. And that status, I think, will include opportunities for application for funds. So there's 96 million overall that's coming to the county. 20 million of that is being set aside for COVID-specific uses. And then after that, there's strong interest in getting the funds out to the community.
Have they kind of identified a specific amount for mental health or allocated to other divisions?
Not particularly to the division. They just have announced that the 20 million is set aside for COVID.
Right.
And the rest is going to be, they're going to talk about a process for application for that. So the Behavioral Health Division is creating a list of proposals. The way we're organized is, we'll create proposals, we'll present that to the department, and then the department will decide what it will take forward. And one of the specific areas we've discussed that we want to highlight in our proposals is the peer certification process. So as Carol has pointed out, the state is establishing a peer certification process. Ideally, this will be followed by the state creating an opportunity for Medi-Cal billing for peer services. And that this will all promote the increased availability of peer support in our system. As I've described, we have been very interested in this, but we haven't had any, I've not seen any funding opportunities with this that would enable us to clearly take advantage of this. So we are going to talk with internally with stakeholders, including West County Community Services and Carol and her peer support advocates about crafting a proposal that would put us in a position to better take advantage of what's developing with the peer certification process. And then after that, we're going to look for making some proposals to increase service capacity, which is a significant issue right now. We do not have enough capacity either in the adult or children's services to meet the needs. The funding will be available for 2 years through 2024. So anything we do would need to be a system or program development kind of project. It's not designed to be ongoing service provision. The exception is I will request some service expansion funds to address the current situation, and then look for opportunities to address that over the longer term as well. So
Bill, is there any specific program areas that need the funding the most?
It's generally adults and children. So our case management is our foundational program, right? It has the most flexibility. We can provide services wherever people are, and then it allows us to do different things, right? So we can engage in a therapeutic interaction that's very much a one-to-one therapeutic interaction, or a rehabilitative teaching kind of practice. So all of our case management programs in youth and adults are overbooked. After that, there's a shortage of individual therapy. I mean, we've pretty much done away with individual therapy in our adult programs because of funding, because of the funding status. And again, we utilize case management to provide that level of support. In the youth area, we have assigned individual therapy to the 3 primary contractors. And again, they've been unable to hire staff, so we're having capacity problems there. So it's in case management, children and youth, in individual therapy, children.
Has telemedicine helped at all with the individual therapy?
So telemedicine has helped in that it's decreased the reduction in our service capacity, right? So our service capacity is severely impacted by the fact that our workforce and the contractor's workforce isn't able to perform at 100%, right? So we have numbers of positions that are filled with individuals who can't work full time. So to the degree they and others are able to do telehealth when they cannot go out and do in-person services, that has been a benefit. But it's we're going to continue to look at the numbers and the data we have. It would appear at this point that acuity is going up. The numbers of people are not necessarily going up, and people are going into higher levels of care, including hospitals and institutions, and that our focus needs to be on increasing the intensity of our outpatient programs to see if we can impact that dynamic. So that'll be a focus this year as we reopen. We're going to have to find more resources in the system, and then we're going to have to, continue to adapt to the changing situation.
This is Carol. I can't see myself, so I'm not sure if you can see or hear me.
I see a picture of you.
Okay. I'm wondering, is that because of COVID that there is reduction in interactions at a therapeutic level with adults, or was that the case before COVID? Is this a COVID specific issue, or is this in general?
I think it's both. I think that the system was struggling as it was, and then COVID has exacerbated it.
So with vaccinations and the lifting of restrictions, are you seeing an increase in interactions between staff and clients?
So there's been no change in our work status at the county, and there won't be a change until the county as a whole has completed all the processes it needs to go through to reopen. That said, we're one of the few divisions that have been providing services throughout the pandemic. So CSU and outreach programs have continued, and then the case management programs have moved primarily to telehealth, but have provided in-person services as necessary. So when somebody needs appear to be going up, they have urgent need, we've been providing in-person services. So we are awaiting direction from the county about the next step in increasing the availability of in-person services.
And is that being reflected in the budget, that people will be accessing higher cost care because of the reduction in one-to-one care management therapeutic? So that'll be a retrospective, like a year from now or whatever.
Well, so we know that our hospitalization costs doubled this year.
Okay, so you do know that already. Okay.
So we know that from this. So we just ended the fiscal year. It takes a couple of months for all of the numbers to come in and for the dust to settle. But we know from mid-year projections, if the trends continued as we saw at mid-year, and I think at the three-quarter point, we were forecasting that our hospitalization costs would double this year.
So when is the PUF scheduled to open? I know that keeps.
I'm sorry.
When is the PUF scheduled to open, the new PUF?
The psychiatric health facility is scheduled for December, so they now project that they'll complete all of their construction and licensing processes in November, and then and so they would begin admitting clients in December.
When your projection, that saved quite a bit of money for you when the PUF?
I think when you look at our general system, pre-COVID operating, I think the PUF financially may be a wash in that there's not going to be savings we can reinvest. It's going to be a savings in that we're going to get more service. So anytime someone anytime an adult between the ages of 21 and 65 are placed in the PUF instead of a non-Medi-Cal hospital, we save 50% of the costs. But I think what's going to happen is we're going to see an increase in placements, because right now, for example, people sit in the CSU for periods of time and they don't go anywhere. So sadly, that doesn't cost us anything except for the availability. It doesn't cost us anything directly, right? The system's complicated. You don't know what's going on with people who don't get to go to the CSU because someone's sitting in a bed too long. But I think our budget is going to see, those folks are going to move more quickly, so we're going to be spending on them sooner. We're not going to have a cost savings for them sitting in the CSU for a period of time. So I think financially it'll be a wash in the larger budget picture. In reality, it's going to be a savings, and we're going to provide more services for the money.
So Bill, are you saying, is the implication that CSU cost of operating the CSU is basically fixed, whether you've got 6 people, 16 people?
We have fixed costs, and at the end of the day, the way the Medi-Cal system is set up right now, we recover our costs, right? So what will happen when the CSU starts operating more effectively and efficiently is our rates will go down, because we will provide more services at the same cost. We are only allowed to recover our costs. That's good when our costs are very high and we're not providing many services, because our rates are very, very high rates, like $700-something an hour. But when we are more efficient and start moving people out of the CSU, the efficiency will be reflected in a lowering of our rates.
Well, I thought the limitation of CSU was 24 hours. Is that correct?
So it is. So we're not getting paid after 24 hours. So what that means now is clients are getting bad care. We are at regulatory risk. But cost-wise, because we get to settle the cost, if our costs are high, we settle to a high cost. So it costs us more in our match, right? So we have to match, and that's local money. But the drawdown we get also increases. So there's some mitigation to what those costs are.
Yeah. So I was also wondering if, in retrospect, there's actuarial capacity to look at return on investment or the lack thereof during the COVID period, to quantify some of the return on investment savings, or return on investment, not savings per se, but to support the spending that keeps people out of hospitals or out of jails.
I think there will be some, largely it's going to be indirect. So where we already collect and report data, we're going to see increases in costs. So for example, just saying the hospitalization rates doubled over the course of COVID makes the case for the fact that, so the correlation is we know that service intensity went down all over the place, right? SUD groups stopped meeting. Our case managers were not as active as they normally are. Services were not as intensive as they normally are, and hospitalizations went up. So while you can't establish a direct relationship, you can point out a correlation, right? We'd expect more people to go into hospitals, more people to be conserved, more people to go into higher levels of care when outpatient services were not as intensive. So we'll be able to do that. We're not with our existing reporting. So if you're on QIC, you're a part of those conversations.
No, I'm not part of that.
Well, the folks,
Yeah.
the mental health board is, right? So the mental health board has representatives on that committee. And then after that, our administrative support is thin enough. We have a very hard time generating more data, right? So whereas it would be valuable to do more, we don't have the resources to do that right now.
Which are the three contract agencies which have been designated to potentially provide the one-on-one therapy?
For youth, it's Social Advocates for Youth, Seneca, and LifeWorks. So we have continued to work with them over the course of the year to increase their capacity as we've tried to increase our capacity. And we are looking at other strategies to make more services available.
With the increased revenue, has there been an opportunity to increase the cost of living to some of your contractors?
We encourage contractors to negotiate rates with us that reflect their costs. So we have done that. We're in the process of doing that with a number of our regular contractors.
But it's more favorable possibilities than in the past because your budget is in good shape.
Yeah, well, it's a change in strategy. I think there was a point in time in which the division took the position that just don't increase, don't do anything. Our position has somewhat changed in that what we've said is you've got to cover your costs. So increase your rate, and if that means if we can't increase your contract maximum, that means we'll buy fewer services, and we'll have to deal with that. It's not sustainable to have private nonprofits continue to operate with increasing costs and not enough revenue to cover them. So we've taken that position this last couple of years.
Any other questions for Bill?
Yeah, I have one more. Could you make any comments on Measure O funding and how that's going to play out?
So the Measure O funding is being determined by the ad hoc committee. So I'm one of the staff that supports that committee. So we provide information to them, and they are walking through each of the expenditure areas of Measure O. I believe the end of August, the Board of Supervisor meeting is the meeting at which they will announce what they're doing. All the funding would be committed. I'm not the person to confirm that information. Someone else would be, but I'm working under the assumption that end of August is when we will know in the division what's going on.
Do you know when they will appoint the Measure O Oversight and Accountability Committee?
I haven't heard a date on that. I know the applications are in and they're working on it, but I don't know when an announcement for that will be.
So Bill, I know you have to go soon. Any other comments you want to make?
None that I could think of. I mean, we are looking to, support program development in the county. So I have reported in the past that the Oversight and Accountability Commission has money that has funded 2 grants that are going to be run primarily by other entities, but with our support. So this Office of Education has a grant that we sponsored that has received a funding they've received notice they're going to be funding, but the commitment can't happen until the state budget's signed, or the part of the budget addressing those funds is signed. And then there's a first episode psychosis program that is a coalition of the Elizabeth Morgan Brown Foundation, Aldea and Buckaloo, that is also going to be moving forward. And then we still have the CHAFA grant funding in our pocket to purchase a property for jail diversion transitional housing. So that's been interrupted a number of times by the emergency, and we will look now to accelerate that, get that project back online. So those are 3 areas that we expect some program development in the county.
Well, just a comment, we've done site visits now of Buckaloo programs, Progress Sonoma, Community Support Network, and just been so very impressed with the dedication of individuals and their commitment.
Yeah.
All of them, and can't really say anything negative to speak of. Bob, you did the last one for CSN. You want to comment?
I would pretty much support everything Bob has said. It has been impressive to recognize the level of commitment to by the staff at the facilities. And I guess at this point we seem to be, we're kind of limited in contact and interviewing participants, clients, but from the staffing end and all the things we found out about the organizations, it's very impressive. If it's as it appears, they're doing a fine job. Obviously, everybody could use more funding.
I'll send you a report. I interviewed a client from Progress Sonoma and Buckaloo programs, and both spoke very highly of it. And I've completed a report, and I'll be sending it around to all the board members. And you should get a copy too, Bill.
I reviewed them. Maybe I just reviewed a draft version. I read the Buckaloo and Progress Foundation reports that included consumer surveys.
Oh, well, that's a completed report. Yes.
Yeah, so I've forwarded that to the folks at the division who monitor their contracts, so they have that information as they continue to do the monitoring and the contract development for this next year.
But to know that will be fed to those folks as well.
Yeah.
Yeah. I just had a question about the jail diversion housing. Will that be a peer support model? Do you know? That's
what we're proposing. The funding we want to use for that is innovation. So we have set aside, we've earmarked some innovation funding for that, and we are working on that. So that's the plan.
And will that be in addition to or in conjunction with the what's it, JMHP, the juvenile probation, the interfaith? There's a house that Alison Loeb and her probation crew.
It'll be separate. So this will be county operated. So the program will be operated by a private nonprofit vendor. Then the services, the programs these individuals in will be county forensic programs. So the idea is that the case managers, instead of, are going to move themselves, and by that I mean spend a lot of time doing their work at the housing facility, right? So the idea is to create a proxy for an intensive program that's there all the time by taking our existing programs and expecting the case managers will site themselves there during significant portions of the day.
So like a hub model. Okay. Okay. Sounds exciting. So that would be under Sid McCauley or Progress Sonoma. Yeah.
David Evans and Sid McCauley will be the two that are leading that, and they have carried on the planning they did with Progress Foundation from so we, in a sense, transitioned the peer respite planning to this diversion program.
Right, because that links into the peer certification potentially, and links over into the community health worker arena with the transition care network. I'm not sure if that's kind of part of the discussion, in that I know that Santa Rosa Healthcare do have some folks that are linked, I'm not sure how tightly, to the transition care network, that helps to train individuals who have been incarcerated as to be facilitators or peers to help others make that transition successfully. Okay, well, I certainly look forward to that program rolling out.
Yeah. It's I have to say, it's a little bit tricky finding a property in a neighborhood to serve people being diverted to jail. So we've, you know,
NIMBY, not in my backyard, yes, big problem.
Yeah, so we've got to overcome that, and we had identified a really great property, and we made the determination it would not be successful.
Well, one of the groups that we might speak to are the folks that did the local housing in Petaluma next to the police department. The I think it's not Burbank Housing Unit in Petaluma that's next to the police department. Apparently that was a problem, but they engaged I'm not sure if it was a company or at least a process to engage neighbors, and that is a very successful unit. With significantly, people that need significant assistance with behavioral health issues, not necessarily, have been in jail, although some of them have. And I think the location next to the police department, literally right next door, was a selling point. So I'm not sure if that's possible in Santa Rosa or not.
Yeah. Well, we're working with the real estate team right now to try to find us a place that meets our needs and we think could get through a successful implementation process.
Okay, that's an exciting program.
Any other questions for Bill? Well, thanks, Bill. Appreciate your coming to the meeting.
All right. Thank you all. Talk to you later.
Thanks, Bill.
Bye.
Hi all, can you hear me? It's Betsy.
You've gotten a copy of the minutes of the June 15th Mental Health Board meeting. And we'll approve those at the July 13 meeting. Just a comment, Mental Health Board meeting is going to be July 13, not July 20. So if you have any comments on the minutes of June 15th, send them to Tori.
So I didn't catch that. Well, that is, Robert, is that a change in date of the Mental Health Board meeting?
Yes, it's going to be on the 13th instead of the 20th.
The 13th, okay.
And then in terms of board planning, special topic presentation, I think Kathy has arranged for Wendy Wheelwright to talk about QAIC. Is that correct, Tori? Okay.
Yes, that's correct.
And there's been no follow-up on the board of supervisor representative to MHB meetings twice a year. You remember that was a proposal rather than one person identified to have each of the 5 supervisors just attend 2 of the meetings if that's possible. We have 10 meetings a year. I don't know if that's realistic or not, but that was the kind of the goal, but I don't know if anything has happened in that regard.
Bob, if I haven't seen, well, I haven't looked at the agenda for the 13th. I'm just wondering if during the peer update time or separately, if that's already used, if we can do an SB 803 update. There's significant movement happening on that now.
Is that the certification legislation?
Yes.
Okay, sure. Yeah, you have the agenda just below the executive committee agenda. the next MHB meeting agenda. The Peer Coalition intern report on activities, SRJC, but we could also have an update as you indicated. Who would provide that update? Would that be,
That would be me.
okay, Carol, great. Okay, other reports. Carol, do you want to update main and detention facility? Anything going on?
There's been zero activity in that arena, nothing.
They don't respond, do they? That's my comment. You send an email, they'll never get back to you. I don't know, they don't never get back to me.
Well, I think, we would need to get together as a threesome or anyone else who wants to be involved and kind of maybe revamp and re-engage. I think we would need to be clear ourselves about what our next steps would be. So I think perhaps that's our next step, is to reconvene.
Do they have someone representing mental health on the planning committee for the new adult detention facility?
Well, I don't know anything further than, when we last spoke. So yes, they do. They have both a clinical team member who's Robert Travelstead, and they have the, physical building representative, which is, I forget his name at the moment, but it's a different person. So there's two people who are key to that moving forward. And they did hire someone to replace Katie Capetto. So there is a new person in that clinical role that's a WellPath employee.
But in the planning for the actual adult detention facility programmatically, they've not asked for anyone, any consumer or mental health participant.
Not that I know of. They may have, external to our purview, but I don't know.
Okay. Any other updates? I can give an update. We've interviewed people at Buckaloo programs and Sonoma. That was back in May. In April, we did a program site visit, a Progress Sonoma, and then that was with Kathy. And then Bob and I did a update and review of Community Support Network, which was 2 facilities, Brown Street and Hope House, which are residential facilities. And then scheduled for tomorrow, Betsy and I will be interviewing Wendy Wendy from the mobile support team. And so they'll give us 4 site visits so far. Then the next one, get your feedback, what would be someone from West County Community Services, and I was in Petaluma Peer Recovery Center. I was wondering, if we do that, Carol, could you participate?
Sorry, what was that one?
Petaluma Peer Recovery Center.
Oh, sure, I'd love to do that one.
Is there any other one that operated by West County Community Services that you prefer?
Well, there's four peer centers, so I don't know if we wanted to visit each one of them. There's Petaluma Peer Recovery Center. That would be Cameron Scuddy is the director or the manager. There's Interlink, which would be Sean Kelson. There's Wellness and Advocacy, which is Sean Boland. And then there's the one, I'm not sure in what capacity it's operating, the one in Guerneville, the Empowerment Center. So there are 4.
Yes, but one of the questions, generally we pick one of the programs so we could go in depth. But we could start with one. If we find we could go with more. But if you were to pick one, which one of these would you pick?
I think the one that has the most impact is Wellness and Advocacy Center. Before COVID, they were seeing about 170 clients a day. I don't know what they've managed to keep going during COVID. I know that they have laundry facilities and post Petaluma is very, very small, and they've had to, operate at 50% or less than 50% capacity. So for them, that literally means that it's the staff plus one or two other people. So in terms of capacity to provide services, Wellness and Advocacy Center would be the most active.
So I'll be in contact with Sean Boland to set up a time.
Sorry?
I'll be in contact with Sean Boland to set up a time for us to do a.
Okay.
science Zoom.
Okay.
So that's the one we'll pick. And then MHB acknowledging Sonoma County Behavioral Health staff recommendation with Kathy is Wendy Wheelwright. Make a presentation after she's going to present on QIC at the Mental Health Board, but to provide her with a certificate. Is that okay with people?
Sure.
Yes.
Yep.
Sounds great.
Then email sent out 5/20 on the County Sonoma Behavioral Health Unit update on MADF. What does MADF stand for?
MADS,
An adult detention facility, I believe.
yeah.
Oh, we already talked about that. Okay. And in Chair's report, there's 3 vacancies, one in District 2, 4, and 5. Any developments there? Have anybody talked to you about interest in serving?
I have nothing to report for District 4.
Bessie, you or Carol have anything to report?
On the vacancies, no, I don't. I do have an update though, but I'm not sure.
Oh, go ahead, Betsy.
Okay. And I'm traveling, so my camera will remain off for the moment. But I wanted to share with you all, a couple weeks ago, Lucien held a forum that involved youth. And it was a specifically, it was a specific program that talked about mental health and the pandemic. And it was really, actually really insightful. All the content that was shared by the youth was very compelling, but I wanted to, I don't have the link with me at this point, but I will send it over in an email. I think it's worth checking out because it's a pretty diverse group of kids that are at the high school level. They're very well spoken. They're involved, well resourced with the involvement that they've been able to do throughout the pandemic. But they did, highlight some specific things that they'd like. I think the general, they're a county to do more for around mental health, and they talked a lot about, just the anxieties and the fears and everything that they've felt, but more specifically, there was some call to action that I think is worth listening. So I'll send that over to you if you don't mind. I think it's about an hour, a little less than an hour. It's about 30 minutes of them sharing their feelings and just, general information and the call to action. So I think it's good use of time.
Betsy, was there any conversation about vaccination?
No, they were just, the focus was mental health education and no talk about the vaccination, unfortunately. But there will be, it was the first annual, there will be, so meaning that it'll continue, these forums with youth involved will continue on a yearly basis. And that is actually a really good topic that I will bring up at the committee. I also feel that there are in other groups, I think that, our youth are definitely in need. And I did hear Bill, talking about the budget and just, how complex it is at the moment. But I do think that having that one-to-one mental health services, especially with everything that has happened with our youth, the fires, the pandemic,
the distance learning is worth looking into. I do see there's a question about SB 224 in the Q&A section, and I believe Tori mentioned that that's specific to Bill, but I think I'd be really great that we here have a discussion about that, because that is important.
What was attendance like, Betsy?
The attendance, it's well attended, actually. The Los Cien, usually, so what they have a Facebook page where they post all their YouTube videos. It's hosted via YouTube and Zoom. It is also transmitted via various, I think a couple radio stations, KBBF and another, I'm blanking on the name. But so it's well attended. And I do also know that the youth invited their respective school leadership members to attend, and there were various teachers that in attendance that day as well. And also principals and such. But I do know that it lives on Facebook and it has a good number of views after the fact. And so it's something that we could share amongst our network of folks. I do think it's something that we should all kind of get a preview so that we can address the issues as a community and not individually. So.
Was there good representation from all the school districts in the area?
There was, I think mainly, I do know that we missed Sonoma Valley specifically, but I do think that there was representation from Windsor, Santa Rosa, I believe, Rohnert Park. And there wasn't too many students. They wanted to keep it small this time around, only because it was their first time hosting, and they also wanted the youth to have enough time to answer the questions and go into deep dive into some of the Q&A from the audience as well. And so the call to action was very specific. So I think that our community can do some work towards that, the call to action that the youth presented. So I do feel that the county at large will have access, and hopefully will watch the video themselves. And then we will be Los Cien is also going to be hosting this month somewhat of a follow-up to that, but utilizing the parent voice, and it will be in Spanish. And I will be translating it into English for participants who need the translation. And so it's going to be addressing education again, but as many of the topics that the youth covered, and through the lens of the parent.
That sounds great. No,
Yeah,
about the video summary to people who did not attend.
Yeah, so I've just posted, it's Carol, I've just posted the link from the Facebook where you can watch the video recording. I've put in above that who the panelists were, and then the link to the Facebook recording.
That's great.
It was awesome. I did attend. It was amazing.
Oh, that's great, Carol.
Yeah.
Yeah, it was really great. And there are going to be more opportunities. I feel like this is the time where our schools and our districts are elevating youth voices, which I love. SCO also has launched a website that captures a lot of what was said through their youth voices forums that they hosted. And there were, the focus was Latinx, Black, Asian, and Native American our youth to talk about what they faced throughout the pandemic as well, and other topics like racial justice and mental health and education and equity in education. And so those are great resources to have to access for all of us who are interested. I also attended a listening session yesterday with the Catalyst Fund here in Sonoma, and something that I continue to hear over and over in various platforms is that our youth are needing mental health support, and also not only that, but just support in general. I think there isn't enough platforms for our youth to speak up, to talk to someone, and to support the issues that they are facing. And so I think that's something that we should maybe, talk further about, because in terms of how do we allocate funding, and how do we sustain programs that are doing the work, but aren't just, they aren't long. I mean, there's, the emergency funds that are covering right now, the basis of it, but for the long haul, I'm more interested in how do we help these programs and sustain them.
Right.
So that's my update. So thank you for the time.
Oh, thank you. Okay.
And one of the things,
Oh, go ahead, Carol.
sorry, one of the things we might want to tag on to that that was presented through CHIPA, and I'm sure they presented at other places. And CHIPA is the Community Health Initiative of the Petaluma area, and hosted by Petaluma Healthcare District. They did presented the Youth Truth Forum material, which is also, I believe, was administered through SCO. Betsy, maybe you also know something about that, it's a survey that's done.
Yeah, it's a survey that's conducted by a nonprofit organization, and it is funneled through the EC, shoot, I'm blanking on the name, but it is the technical. It's run by Kathy, the tech program in the county, and I'm ETC, I believe. But it is in partnership with SCO, and it was delivered, and the presentation has been distributed, and I think we've shared that information with this group, but I'm sure, Carol, you have access to it and you can share it again as well. But yeah, very compelling information that is specific to the needs that have come up throughout this year, but also taking into account other issues like the fires and such. So yeah, very valuable information.
Right.
And I also, just one last thing, sorry. We in Sonoma, we've launched the Healing Justice program that Doctora Daniela Dominguez is leading with our colleague Richard. And that is specifically going to be set by students for students. And so they've rounded up about 20 students here in Sonoma Valley to talk about suicide and suicide prevention, and through some foundational tactics of her own, but also other guest speakers that have been coming to speak directly with the students and work with them to develop a program that suits the needs here in Sonoma. So that's pretty exciting. More to come on that.
That's great. Thanks, Betsy. Bob, do you have anything you want to update the group on?
I'm sorry, say again?
Do you have any updates you want to provide?
No, I don't have any updates. Thank you.
Carol, do you have anything you want to add?
No, just that there is movement on the SB 803 peer certification, and I think Bill's discussion this morning kind of covered most of those bases. So they are moving from the DHCS standards, setting standards. The standards were released for comment, and it's now moving to Cal Mesa. And since we are one of the smaller counties, I would imagine that Bill would want to go with the Cal Mesa option for having them be the agency to help implement. So the real short pole in the tent is finding the funding. I think everyone wants to move ahead, and this Americans Recovery Act funding is a potential way potentially to get the funding to move ahead with that, but it is a competitive process, so there may be other things that are priority. But
Did the state pass legislation supporting the process of developing peer certification?
Yes, in September of 2020, it passed, but it was an opt-in option. So counties have to opt in. It's not automatic. And the reason for that is that if it was automatic and required and mandated, that the state would have had to foot the bill 100%. And so they said they did not have the funding for that. So it was a compromise. And so counties, when they opt in, do have to find matching funding to help with the implementation. So that really is the challenge, is how do we find that funding to do that?
So what's Sonoma County, what has it done so far? in funding?
I think Bill wants to move forward. So he would like to say yes, but he cannot unless they find the funding. But the carrot is that if we do go through the process, is that peer support specialists who are certified can then bill Medicaid, Medi-Cal, which has not been the case to this point. So that really is the carrot in the long term, that peer services would then be billable. It wouldn't cover all the costs, but it would certainly go a long way to building the infrastructure and the recognition for peer support specialists, not just in the peer centers, but across our system of care, so that peers would then be able to be employed, not just as extra help, which they have been to this point, but in full-time positions. And potentially there's an overlap with a lot of funding that's being poured into the county, into the state, or across the state through the CARES Act for community health workers. And there is a lot of overlap between peer support specialists and community health workers in the arena of behavioral health and peer support. So, and that includes transitions from prison to back into the community after a stay in jail. So for me, it's an exciting time. There's a confluence happening between peer support specialists and community health workers. And there's also the funding that came into the community through the Sonoma Connect, through ACEs, ACEs Aware funding. So that's under Sarah Rock. That's, I believe, a 2-year program that has really generated interest. And the public health department, so it's outside of behavioral health, but has applied for the CDC funding for community health workers. If we get it, we'll know August 1st if we've got it or not, and that's $2 million per year over 6 years. And so I think at that point there'll be hopefully a lot more discussion across the workforce that is the frontline workforce of connectors, whether they're community health workers or health navigators or certified application assisters or, you know, volunteers in the community, promotores de salud. You know, they go by many names, the job title, but in the context of behavioral health, they're known as peer support specialists. So, but there is funding coming in from alternative sources, and it will overlap into physical health arena.
It sounds like the majority of the funds would be the first 2 years to get it started. And then sustainable, at least the peer support specialists, if they bill Medi-Cal, will offset some of the costs. Is that correct?
Right. So right now, you know, the peer support specialists, the majority of them are hired through West County Services, and that's a contract, which is always up for renewal and under threat every year. It used to be MSHA. We hope it will be reinstated as MSHA funded, but at the moment, this year, it's under the PG&E money. That's where they funded it for this year. Last year, I can't remember what it was, but it was also a salvage operation last year. And I think the intention moving forward, certainly from Bill's perspective, is to really look into sustainable funding for peer support. And part of that process would be to move forward with peer certification so that we can bill Medicaid, Medi-Cal. that would be part of that process.
Any future topics you want to discuss at the executive committee? Next one. We don't have one in August, correct, Tori? And there's not a mental health board in August either. So the next
Yeah.
time we would meet would be in September.
Yeah, I think one of the
Yes,
topics.
we had, sorry, Carol. We
Nope.
had agreed on going back to the original calendar, which was August being off. So after July, the next executive meeting would be September and board.
Any final comments anyone wants to make?
Yeah, I'd like to, sorry, Bob, after you.
Real quick, there was a Q&A from Lisa Hooks that we didn't get to, and I'm not prepared to respond to it. What is your position on SB 2247? It would require students in California to receive age-appropriate mental health education. I'm wondering, Tori, if you might bring this to Bill's attention, and possibly at the mental health board, he would be able to make a comment on that. Thank you.
Sure, I will email him right now.
Great. Good, Carol. Thanks.
Okay, and then for the next executive, I would like to put on the agenda something to do with the community program planning, the CPP, MSHA CPP process. The mental health board is the oversight and accountability arm of that process. And we do have a work group presently meeting to implement a more robust CPP, but at this present moment, it is still a zero budget item. And MSHA allows for 0 to 5% of the MSHA budget to be applied to that process. What it essentially does is create opportunities for community input. the mental health board is one of those, but a more robust CPP process includes community members in an ongoing way to inform policy and program planning and the 3-year plan for MSHA. So would like a kind of deeper discussion about what our role as a mental health board is in ensuring that that process occurs and is funded.
Tori, do you have that? Do you make notes on that? Okay, I have those. Carol, can you follow up with a brief email on that?
Sure.
Be great. Well, thanks, everybody. That's all we have for today. See you in September. Actually, see you next week.
Yeah, next week and then September. Okay. Thank you.
Yeah, I will be working on the agenda for next Tuesday and sending out a draft. If you could look at it and let me know if you want any changes as soon as possible so I can post it to meet the Brown Act requirements, that would be awesome.
Great. Like before the end of this week, we get back to you if we need to. Would that meet your needs?